Hello and welcome to Health Options. Nigeria has taken another bold step aimed at not only boosting access to basic primary healthcare services, but address barriers toward the supply and demand side, among other things. Talking about the Community Health Influencer and Promoter Program, CHIPS, which was launched by President Muhammadu Buhari during his visit to Nasarawa State. We have a discussion on that. Join us on Our Nature's Corner as we showcase some medicinal plants and other natural ways to deal with constipation. There is so much to gain from our health tips, and you will, of course, get to meet our health champion. Glad to have you join us on the program. I am Rabi, Abdallah. In the face of high maternal, infant and child mortality rates, the overall aim of the Community Health Influencer and Promoter Program, CHIPS, is to improve access and equitable coverage to essential health services, especially those related to maternal, newborn and child survival by 2020. Let's take this background report.
The President launched the initiative in Kwandere community of Nasarawa State amidst celebration by the beneficiaries. It is aimed at addressing challenges of human resources and revitalizing primary healthcare centers.
I am also particularly pleased to launch the pilot scheme of the Community Health Influencers, Promoters and Services national program here at Kwandere Lafia local government area, and to direct the Federal Ministry of Health to synergize with other states to roll out the program to enable the less privileged and rural dwellers to have access to health services.
This pilot program is in line with your commitment of providing at least one functional primary healthcare center in each ward across the country.
CHIPS is also aimed at linking workforce at primary healthcare centers in rural areas with households in order to tackle delays in decision-making for healthcare. An average of 10 women in each ward across the country will be trained on basic health services such as provision of first aid, motivational talks and promotion of hygiene and sanitation in the communities. President Muhammadu Buhari, while flagging off the program, directed Federal Ministry of Health to synergize with state governments to adopt CHIPS program in order to improve healthcare delivery in rural areas.
So it's a proud moment for Nigeria, and our women, our children, and then our men, of course, will be better off.
Nasarawa State has taken a lead on implementation of the program with expectations of replicating the initiative in the country. In Lafia, Joshua Ojito, NTA News.
Joining me in the studio to discuss the newly launched program, CHIPS, is the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency, Dr. Faisal Shoaib. Welcome to Health Options, Doctor.
Thank you very much.
Okay, we could call it another milestone, a boost for maternal and child health. Talking about CHIPS now. Can you give us a broader insight into the program? What is it all about?
Muhammadu Buhari launched the Community Health Influencers, Promoters and Services program, known as CHIPS for short. in Lafia, Nasarawa State, making it the first state to launch the CHIPS program. The CHIPS agents are women who have been selected in their communities based on the merit system in collaboration with traditional leaders, political leaders, and religious leaders. They are going to be upskilled, they're going to be trained on how to address basic health challenges in the communities. They are at the level that is below the health facility. So it really keys into President Buhari's vision. When 3 years ago he came into power, he laid out a clear vision that he wanted every Nigerian, irrespective of where they live, their socio-economic status, to have quality primary health care. And what the Federal Ministry of Health and the National Primary Healthcare Development Agency have done is to roll out this community health workers program to sort of harmonize all community health workers to provide quality health services where people live and work in a way that ensures that if, for instance, somebody has a bleeding wound in the community, they'll be able to treat these wounds urgently. If somebody has maybe a fever, a child has a fever, they'll be trained on how to identify the symptoms of fever, to do tests. They'll be given rapid diagnostic kits among the commodities they will have. They will do a test for malaria, and if a child has malaria, they'll treat for malaria. As you well know, bleeding is one of the commonest causes of maternal mortality in Nigeria, and Nigeria has one of the highest maternal mortality rates. So there's a drug that is known as misoprostol. These community health workers will have this medicine in their toolkit, and if they're in a community and we have any pregnant woman who is having a baby and has bleeding from any cause, before that bleeding becomes a potential danger to her life, they will provide that medicine to stop that bleeding and link such a woman to the next level of care, which could be the primary health care facility or even a secondary health care facility. So this is really revolutionary when it comes to healthcare provision in Nigeria. So there's no doubt in my mind, you know, when we left the venue of the launch yesterday, that, you know, future generations of Nigeria will look back at what was done yesterday by President Buhari and say we took another bold step towards keeping our promise to provide innovative solutions that will improve the health of each and every Nigerian.
Does the program have a time frame?
So what we're looking at is that in the course of the next 2 years, and that's exactly what President Buhari has charged the Honorable Minister of Health to do, that in the next 2 years we want working with governors, with the legislature, to roll out in every single ward these CHIPS agents. At the end of the day, when we're able to roll out in almost 10,000 wards of Nigeria, we'll have a complement of nearly 200,000 CHIPS agents. This will make them the largest aggregation of community health workers in Africa. They will go from house to house, knock on households, and find out, are there people who are sick? Are there kids who have watery stool? They'll manage these cases, because one of the reasons why we have high maternal mortality and morbidity, and also child mortality and morbidity in Nigeria, is because of that delay in the community. So they are going to be there in the last mile, right? So that where the doctor might not be, where the nurses might not be, where the community health extension worker might not be, you have these people in the communities living with community members, understanding what the challenges are, being trusted by community members to provide this level of care that will ensure that, you know, by the time the community residents get to the health facility, they are not in a situation where, you know, they are almost dying.
Okay, let's look at the demand and supply aspect of this whole thing. What is it going to be like? And talking about sustainability now.
Sustainability is very key. It's really inbuilt into the whole program. So what we have done, and this is exactly what President Buhari said yesterday, that the state governors now need to embrace and roll out the CHIPS agents. The state government will be responsible for paying their stipends. Now, this is going to be context specific. So in some states, you know, some governors might pay quite high. In other states, governors might say, okay, this is what we can afford in a way that is sustainable. What is very clear is that for a woman to be identified in her community as somebody that will have this badge as a CHIPS agent. It's a recognition that people will appreciate. To now link that up with some stipend and some income generating activities, we feel will help with sustainability. And very central to this is that these women will live in their communities. They will be chosen from within their community. So we're not going to go across wards to get people to come and live in communities that do not belong to them. So the people that are already trusted, and they will be recommended by the traditional institutions.
Any specific criteria?
So the criteria that has been set, because we do have all kinds of village health workers, traditional birth attendants in our communities. But what we're saying now is we're going to standardize what the criteria are for these community health workers, right? So for instance, you must have basic elementary school education. You should be a female, at least 25 years old, and then you will have to be trained in the course of about 6 months, right? So that we're not sending people out there who do not know their left from their right, but people who have the skills. And then for those that are already in similar programs, we're going to upskill them so that they'll be able to do basic things such as carry out tests for malaria, give treatment, be able to examine a woman, see that she's bleeding, and know what the danger signs are and refer to the next level. But very key in this is that they must be trusted people in their communities. We're not going to take strangers and take and make them CHIPS agents. They must have the confidence of the people in their communities, because apart from even the treatment, apart from the services that they're providing, they will also influence health behavior change communication in terms of saying, if a child is born, what are the things that need to be done? You need to take the child, for instance, to the health facility for immunization. If a woman is pregnant, she will tell the woman, what are the things that you need to do in terms of nutrition, the fact that you need to go for antenatal care, you need to take some vaccinations during the period of the pregnancy, but actually doing it in a way that is compassionate, in a way that shows empathy, that all what we are as Nigerians, right? We're well renowned as people who empathize with our neighbors, we care for each other. But to have a CHIPS agent moving from one household to the other, asking questions that show that people really care, I think that's exactly what the spirit of the CHIPS program is all about. Okay,
I won't let you go without asking you this question. An emergency National Council on Health meeting was convened,
right?
Because of the Lassa fever outbreak and other public health challenges that the country is grappling with. And the Honorable Minister of Health made mention of the fact that there are still some states who have not paid their counterpart fund for the measles campaign. What's the implication of this?
Right, so the counterpart funds are the funds that the state government are supposed to provide for the measles campaign. We've seen a lot of governors have been very supportive. When we went to the Nigeria Governors Forum and talked about the need for the measles campaign, a lot of the governors actually did respond. But one thing that we have seen is that sometimes the governors will approve the funds and then the release is delayed. So for instance, for the North Central states that are actually carrying out the campaigns now, we have not gotten any indication that Kwara and Kogi states have released funds. So unless those funds actually go to the State Primary Healthcare Development Agency accounts, then it's just been approved and not released, and they cannot work based on just the approvals. And then for the southern states, we find a situation where in the southwest, Lagos is yet to release the funds. Ondo State, Ogun State are also yet to release the funds for their measles campaign. In the south-south zone, the River State paid partly, so they released part of the measles counterpart funds, but we haven't gotten any indication that Cross River and Akwa Ibom states have released. So these are the states that I believe are still in the process of releasing those amounts of money that are required. It is important that those funds are released, otherwise we'll not be able to have a good campaign. In fact, we have specific dates that we have communicated to the state government around the deadlines for the funds to be available to the state primary healthcare development agencies, or they will not be able to have a good campaign, in which case we'll sort of stop any further progress with the campaign until the funds are made available. But so far we've been, you know, getting very good cooperation from the governors. I just think that maybe the commissioners need to make those releases happen along the chain.
Okay, thanks for coming on Health Options, Dr. Faisal. We will surely keep track of chips as you implement.
Thank you very much.
If you're just joining us, this is Health Options. How often do you move your bowel? Regular bowel movement is an integral component of healthy living. Find out some of those medicinal plants available for the treatment of constipation as we take you to our nature's corner.
Constipation is something that almost everybody has experienced one way or the other. The truth of the matter is there is no prescription to the number of times you should move bowel in a day. The type of activity you engage in also affects how often you move your bowel. The type of food you eat also affects how often you move your bowel. Ways by which you can generally take care of constipation without going to see your doctor is, in a natural way, is that fruits and vegetables, because fibers, taking a lot of fiber helps to in bowel movement. A lot of us go to pharmacies or even patent medicine shops to get drugs once we think we are constipated. And there are so many drugs actually in our health facilities that you can use for constipation. But most of these drugs are chemical entities. And that is what we want to address, because all of these drugs are imported into our country. Whereas if we look at our environment, you see that we have a lot of our medicinal plants that can be used. There are several medicinal plants in our environment, which I'm going to show you some now that we can use in management of constipation. The idea here is not to tell anyone that these medicinal plants I'm showing you, you go to the backyard or go to farm, you cut it and go and squeeze it and start drinking it. That's not the idea. This is powdered product obtained from Cassia alata. In Hausa, it is called Filascan. It is very, very effective in constipation. In fact, extreme, what we call very extreme constipation can be handled by a product obtained from Cassia alata. This is called Gueria senegalensis. Gueria senegalensis is a sabara. Is also very effective in constipation in this form. These have been developed to the form that they are all the doses that are required to be taken are already known. That is the difference between you going into the farm to get these plants and start squeezing it or pounding it or putting it in a cam. The truth is, you do not know the quantity you are taking. Well, that's what we call dose. And that's where science and technology comes into play, because we need to know the dose you are taking, because the dose you take is a function, it depends on your weight, your age, and you know, a lot of other factors, which we take into consideration when we are developing this product in a scientific way in our laboratory. This one is called Ricinus communis. It's very, very popular. Ricinus communis leaf, the popular castor. This is the leaf. The seed is used for other things. The last here is called Diospyros mespiliformis. It is a Kenya. Yeah, in Hausa, that is the name. A lot of our people in our rural communities use these plants the way they are. Some of them, like these leaves, in water or in local gin. Allow them to macerate, we call it maceration, in the soak, and after some time, they drink the extract, and they are relieved of the constipation. We do not need to import anything. All we need to do is to go to our farms, our agricultural farms, harvest these things, take them into the lab, and then apply modern science and technology to convert these products to our own indigenous Nigerian medicine.
We surely look forward to when Nigeria will fully tap into the potential of its numerous species of medicinal plants for healthcare. Nigeria is making efforts to curtail the current outbreak of the deadly Lassa fever in parts of the country. These health tips on the disease should benefit you.
So Lassa fever is a viral hemorrhagic fever caused by a virus called Lassa. We've been having outbreaks in Nigeria over the past few years, but what really has happened over the last year is that it's no longer just common in epidemics, but we're actually having cases all through the year. I mean, one thing that's led to this is increased and improved surveillance and detection from the Nigeria Center for Disease Control and our laboratories across the country. However, as government is trying very hard to control this outbreak, everyone has a role to play. And the first role you have to play really is in prevention. And how do you prevent Lassa fever? The first thing we all know, or most of us should know, that Lassa is transmitted by a rat. So how do you keep yourself free from Lassa? You keep your home and your foodstuff safe from rats. The first thing is to avoid and try as much as possible to avoid anything that will attract rats into our environment. What does that mean? No refuse. If you have refuse heaps or leftover foods, try and get them out of the way. And if you must keep food overnight, please keep them covered. So that's the very first thing. The second thing really is if you do have a fever, and you may have, if you do have a fever, it's very easy these days to get the diagnosis. So go to your doctor, insist on having a rapid diagnostic test for malaria, because if he can rule out malaria, then it's possible to start looking for other causes of fever, one of which can be Lassa fever. And it's important to realize no doctor can make a diagnosis of malaria just by looking at you. They have to give you a test, and then they have to rule in or out malaria. If it's not malaria, he will start looking for other things. So with these few things, we hope we can prevent the spread of Lassa fever. Now, one final critical point is among healthcare workers. Now, no patient comes into the hospital with Lassa fever written on his forehead. So everyone coming can possibly be a case of Lassa fever. So we're really encouraging our healthcare workers not to forget universal precautions. Use your gloves, use your face masks, wash your hands if necessary. Generally keep the hospital environment clean and safe for yourself and for your patient. By doing all of this, we can really prevent Lassa fever from spreading and causing the outbreaks it's causing in Nigeria.
She went to school to acquire the skills and knowledge of treating the sick, but her passion for humanity led her to do what other people of her age might never have given a thought. Meet our health champion.
According to Hippocrates, the father of medicine, whenever the art of medicine is loved, there is also a love of humanity. That is exactly what Dr. Promise did. The 27-year-old doctor did the extraordinary in the course of our National Youth Service. The plight of the people of Gishiri, a suburb in Abuja, got her attention. The community did not have access to basic health care.
And before I carried out the project, I went to the community and I made observations, and I asked the chief and some of the opinion leaders and also people living in the community of their needs, and then a list of their needs. They actually gave me a long list of their needs, but the health post was their most pressing need. You know, they wanted health care to be readily available to them and very affordable. So So I decided to pick on that one and go on the project.
Curious about how she got her funds for the facility that was inaugurated last year?
I must confess that it was very difficult. But, you know, there are still some kind-spirited individuals. So I got my funds from individuals who believed in what I was doing. I got my funds from organizations who also believe in what I was doing. I got my funds from even church who also believe what I was doing.
A visit to the facility indicates it is serving the purpose.
We thank God for what has happened today. Healthcare for us today. May God help the coppers and may God give them work as they finish.
The women of this community now have access to immunize their children here every week on Thursday. You know, initially we go out either to Metama or Mabuchi, PHC, but now they no longer go out. They use this place for the immunization. They use this place for the antenatal women come here for the antenatal services. And we also treat minor illnesses here.
This and what she would do if she gets the opportunity of becoming Nigeria's health minister someday. Her response:
wow, that's a very big privilege. Okay, I'll concentrate more on primary health care. You know, I believe that health is very easy access to health care at their grassroots. You know, there are some problems that won't escalate. Once they have the problem, they come in, it is sorted out, and that's it. For the ones that the primary health care cannot handle, you know, they do referral to the secondary health care and then tertiary health care. So I will focus more on health care at the grassroots.
Young Dr. Promise making a difference in her own way. What about you? Thanks for investing your time with us on Health Options. Until we come your way again, make informed health choices. My name is Rabi Abdallah. Goodbye.